Hi, welcome to Look Into the Glass. It's another beautiful day. Hopefully we're recording. Um, today we have Paula Yost again today, and we're going to discuss preeclampsia and our individual experiences that we had with preeclampsia, and the things that we went through, and just the toll that it took on us. And we'll see where the conversation takes us. Giselle, do you want to start? I'm going to put you on. Or Paula, would you like to start?
Well, I mean, I think Giselle makes more sense because she's probably
She's
had
the
it more
one that went through it
recently.
just recently. Yeah,
Yeah, let's hear about this recent experience so we can see if it's improved any since you and I had it, Sela.
agreed. I love that idea. Hold on, I need to turn on the light. It's so cloudy over here.
So when I first found out I was pregnant, I made my appointment and I went and seen a doctor. I made it a point. That was where I did it. I made it a point that my mom had preeclampsia, and because we were told it is a possibility that it could be hereditary. So I went in and told her my mom had preeclampsia and I was already being diagnosed with high blood pressure. And so I was very much like, we're just gonna go straight on. So they kind of treated me like I was already preeclamptic and having all the problems. They were trying to get my blood pressure under control because that was one of the big red flags right there. Um, which it worked. I was doing different things, trying to take a holistic route with like beetroot and all that before being on the medications. Because me personally, my opinion, not a doctor's opinion, I don't want to be on the prescription pills while pregnant. And
Yeah.
so, I still even on the medication, I was having troubles with the high blood pressure. And being at working and being on my feet, that was another thing. And I asked my doctor, can I be on leave early? Can I go on leave early? Because this is causing my blood pressure to skyrocket too. I'm being on my feet 8 hours, 10 hours a day, sometimes 12 because I was a manager too. And so that doctor worked with me, but because I was such a high risk, she transferred me to another doctor an hour away. This was only like 20 minutes for me, and then I had to go an hour away because this hospital didn't have a NICU. I had to go to a different hospital. They didn't want me to have a baby, and she needed to be transferred to a whole nother hospital.
Yeah.
And so, being my doctors were this doctor I love. He's been great with me, and he made me do the 24-hour urine, and he's like, hey, I'm not thinking you're preeclamptic yet, but we're gonna make sure. And I was just my protein levels were just slightly elevated, and all I did was, you know what, I'm gonna go to the hospital. My mom was like, you need to go to the hospital. And as I was driving to the hospital, I was swelling up. My feet were swelling, my hands were swelling, my ring wouldn't fit on. I had to like pry my ring off my finger because it was so swelled. I've never had to do that in 10 years. So, um, when we got there, it wasn't as urgent as I thought it would be.
Yeah.
They took their time. They took me to a room and I sat there for 30 minutes, 40 minutes waiting for a nurse to just come and give me a gown or whatever the process was. I didn't see anybody for 30 to 40 minutes. And then they finally came in and I had three nurses trying to do the whole procedure of getting me hooked up to IVs, trying to get me medication to bring down my blood pressure, trying to like the whole 10 yards of just trying to get everything done. And they were great nurses. And then they were like, we're going to move you to a different room. Um, because you're going to stay here for a little, we're going to end up getting you, we're going to induce you. Doctor's orders. And I was like, oh, great, fun. And that was a Saturday, like afternoon to evening. And um, the procedures were they took their time, but the mag drip, they told me that the second they put me on that magnesium drip, you're not allowed to get out of bed because it relaxes all your muscles. But we're also going to put you on Pitocin, which counteracts. So now here I am, not ready to go into labor. My body is not ready for it yet. But
Mhm.
preeclampsia, I'm swollen. I'm got high blood pressure and I'm on medication, I was still having high blood pressure.
Even in the hospital, she was having really bad spikes. Like even with them
Random
giving her
spikes.
intravenous medication, she was still
Yeah.
having random spikes. So it was definitely
It
the
went from just
constant
like,
spikes on the blood pressure.
yeah, it just went from like one in the morning, and then it went to twice a day, and then they were starting to go, okay, we're gonna have to give it to you 3 times, and because it was starting to get really bad, and the spikes were getting higher and higher, and I will say that my doctor didn't have faith in me in giving a natural birth. He very much was like, well, you're probably going to end up having a C-section. He very much was, he's like, I really don't want you to for a first time mom, but you're probably going to end up with a C-section. He didn't want to induce me either, but because of the he's like, he told me that I made the right decision, that me paying attention to my own proteins, because I got the test result on a weekend, he told me that I did it was the right choice. I could have waited, but it was still the right choice because it was before it got too bad. And the magnesium drip, the mental load it had on me because
Yeah.
I could not get out of that bed. That bed is the most uncomfortable bed I have ever had on the face of this planet.
Yeah.
And my
It's not
tailbone
a
was
bed, it's a
killing me.
table that pretends to look like a bed. It is not a bed. It is a table. You're
Yeah.
laying that is just made to look like a bed. That's what
Yeah.
it
And then
is. It's a concrete
you
table.
rolling to one side, it didn't help, and rolling to the other side didn't help. And then you have to be careful on how you move because you're hooked up to all these other things, and you don't want to
Yeah.
yank anything out. And oh yeah, it was they took care of me, but right after I had her, I wasn't I didn't really have anybody that come and visit me. Like I had to call for the nurses to allow me to go to the bathroom. And because I was still on magnesium drip 24 hours after having the baby, they wanted me to hook me up back up to the catheter. And I was like, please don't, please don't. I want
Well,
to
was the
walk.
baby in the room with you, Giselle? Did you have the baby with you, or was the baby in a nursery?
So she was in the room with me. I made like they tried taking her to do the testing, and I was like, no, she stays in the room with me.
Yeah.
And luckily, the nurses were the nurses I had before, like during the whole labor part, were amazing. I had wonderful nurses that listened to me, that,
Yeah.
helped me, guide me, and I got very, very lucky in that area. They were very understanding on how I wanted certain things done, and, I was understanding of if there was an emergency, it's fine. I have to accept my fate at that point on an emergency. My life and her life are important. And,
Mhm.
but I was able to have the baby with me, and I was very grateful for it. But after having her, it was so difficult to get anybody to come help me.
Yeah.
Well, I didn't, because these are labor nurses, and then you have these other nurses that kind of monitor everything.
Yeah.
They came in and like they would unhook me and like, okay, go to the bathroom, and because I needed to go, and my husband would stay with me, and then they would just leave. And
Yeah.
so this is their equipment. We're not technically supposed to touch our equipment. This is theirs.
Yeah.
And so I would call them back in and tell them, oh, the machine's beeping. Well, because it wasn't plugged back in, because nobody came back in to check on me. And then
Right.
I would have to go to the bathroom. She's like, he can just go ahead and unplug it and take you to the bathroom when you need to go, because they were allowing me to not be on that catheter. I was walking.
Right.
And, but I was still a fall risk, and that shouldn't fall on my husband. That should be on them. They should be there. They're trained for this.
Yeah.
And so it was
Especially
like
if you
I
paid for
haven't
them to be there for it.
exactly. And it was kind of like I was just completely forgotten about. It came to needing to take my prenatals in the morning and my blood pressure medication. And nope, I waited hours after I ate. I was supposed to have my blood sugars test because I was also um gestational diabetic. And so I'm supposed to have my sugars still tested even after having the baby to make sure I did, my body was functioning okay. And they weren't even
Yeah.
doing that. They didn't do that anytime after having the baby. And
Right.
I was quite shocked with the way I was treated afterwards, and it wasn't the same nurses because they were specific labor and delivery nurses, and I was no longer in that.
Yeah.
But after I got off the magnesium drip, I still had to sit in the labor room because they had no postpartum rooms. And oh my Lord, I mentally lost it. I was crying because I was tired of being in that bed. I was crying because I was tired of being bugged by people because I wasn't getting the rest I needed. Or I
You
wasn't
were
getting the help I
also
wanted.
postpartum, like just people don't talk about that enough. Like 4 days after you give birth, your brain dumps all those hormones out. And that
Mhm.
process kind of begins after the child leaves you. So you are not, I mean, it doesn't mean you're not a good mom or you don't love your kid, but you're not the most mentally stable for a couple days after you give birth because all those hormones, which are wonderful, I mean, they're what create that life, but those things dump back out. And so
Yes.
you do feel like crap during those initial days after birth. Were you on the magnesium drip for a long, like after you had her, did you have postpartum preeclampsia as well, or did your blood pressure kind of re-regulate afterward?
My blood pressure did not re-regulate. My blood pressure was still kind of spiking. They did keep me on the magnesium 24 hours after. And here's the thing that I wasn't too sure on because I lacked sleep so badly. I
Yeah,
was
I understand.
giving medications left and right that were supposed to make me tired. Magnesium
Yeah,
is supposed to make you tired, and I did not sleep. I slept
no,
30 minutes and then I would be up for 6 hours and I would sleep 30 minutes and then up for 6 hours. So
I
after
understand.
I had her and I was off the magnesium and everything, I went and laid on the couch because I was tired of that bed. So I went and laid on that couch and my husband laid in the bed. And as I was laying on the couch, I couldn't get myself to fall asleep. I was in this limbo stage and I don't know if this was a seizure type situation, but I bit the whole side of my tongue
Oh
and
God.
it jolted me awake. I had a lump on the side of my tongue so bad I could barely eat anything for days.
Oh no.
So I wasn't sure what it was, because it just kind of happened in that limbo sleep, but I was fully there at the same time. So I was like I said, I wasn't sure what it was. I happened to like I jolted awake, but that was about all that happened to me, and it happened a couple times until I finally started getting some kind of rest.
Yeah.
But it was a very hard 5 days in the hospital, uncomfortable, constantly bugged, and then going through her being a jaundice, she had to be under the blue light, and you can't move her. She has to be under that blue light. You're feeding her,
How
changing her.
how long did it take you, like after you got out of the hospital and came home, how long did it take you to start feeling like normal again?
I still don't feel normal, and I'm 15 weeks postpartum. um, but to feel somewhat normal again, it took
Yeah.
me about a month. Honestly, to feel even remotely mentally okay, physically okay, just to feel like I can get back into a rhythm. And even then, it's very hard for me. I'm teaching myself to go day by day.
Yeah. I mean, that's kind of what you have to do,
It
unfortunately.
and
My
no, go ahead.
No, go ahead. I was just going to say while you were explaining about your experience, I made some notes because there were definitely things that you and I had in common, but then there were some areas where we differed. One is that I think it is fantastic that you actually knew what preeclampsia was in the first place, and that you had a mother who was able to tell you about it.
Yes,
So I, well, first of all, my mom only had one pregnancy, and it was with me. And to hear my mother, who I'm not close to, but to hear my mother describe her pregnancy, it was like the easiest thing she'd ever done. Like, it was no big deal. She just healthy pregnancy, uneventful, natural birth, no drugs, blah, blah, blah. Whether any of that is true or not, my mom, I don't consider a reliable source, but absolutely
Okay.
no one taught me what preeclampsia was. I had never
Me
heard of it
neither.
before. I had no idea what it was. I actually had preeclampsia with my second pregnancy. My first pregnancy was fine and full term. And so I remembered at like the end of my first pregnancy being told to like pee in the cup, but I didn't really know why I was peeing in the cup. And I remember the doctor saying, your protein's fine. But I was like, okay, like I didn't know what that meant. Right. It
Yeah,
didn't mean anything to me. Just my protein was fine. And the doctor seems to think that's good. So I didn't know anything. And this is one of the reasons I think this show is so important because, and again, I am I have 4 college degrees, and at no point in any of my education did anyone ever tell me that being pregnant could cause me to get a disease that could kill me. And preeclampsia is the number one killer of pregnant women in the United States and honestly probably in the world. And so I had a lot of the symptoms you were describing, Jeselle. Like I was swollen. I had what I thought was diarrhea because I thought I was sick from my kid. I didn't realize preeclampsia makes you have an upset stomach. I was
yep.
having headaches, but I thought I was stressed out, needed to take it easy. Like in retrospect, I see that I had every single glaring symptom of preeclampsia, but I just wrote them all off because I didn't know what it was. I was 26 weeks pregnant. I'm seeing Sheila be like, yeah, that's what happened to me. I was 26 weeks pregnant and I was in my 2-year-old's room and I felt like something was squeezing the base of my brain. Like I could literally feel electrical current rotating through my brain. And I walked out of my child's room, and my husband, who thank God is a nurse, my husband looked at me and was like, are you all right? I was like, no. And I explained that to him. And he was like, yeah, I'm going to take you to the hospital. So thankfully for me, and this is a significant difference between us too, in like not a good way. I live near a major city. So we had a hospital within 20 minutes that had a fully functioning NICU in it. Like it's a totally different ball game for so many women who live in rural areas who there's not a NICU near them. So if they have a problem like you or I have and something goes left, if I had been in a rural area, I don't know what hospital I would have wound up at, but it probably would have been one without a NICU. But thankfully, I wound up somewhere where I did have a NICU and I was only 20 minutes away from treatment. So I rolled up in there. They were like, "Yeah, your protein is like the highest it could possibly be, and that's not good." They stuck me on the mag drip. Honestly, I don't remember what was going on with Pitocin. I just knew I was on the mag drip, and it was the worst thing that had ever happened. And like, honest to God, the mag drip is the most physically difficult thing I've ever done in my life. Um, I know I was on it for 24 hours. They were collecting my urine to see what it was doing. And what they told me was the mag drip is either going to stop your blood pressure and regulate it out, and you're just going to be in this hospital for the rest of this pregnancy, which for me would have been 90 days, which sounded like, put me in jail. Like I
Yeah,
had a job, I had a 2-year-old. Like you can't
that's
put me in a
you can't. Yeah, you
hospital.
can't put me in the hospital for 90 days. That's
And
way
the
too
reality of it,
long.
yes, and the reality of it for women listening to this is yes, they can and they will. And you're going to
Mhm.
have to do it because it can kill you if you don't.
Yeah.
Or if you just sign yourself out against medical advice, then they might be unwilling to treat you in the future. So you really do have to stay there. But I was on the mag drip. The mag drip for me worked for about 2 days. So I always remember exactly my timeline because I wound up in the hospital on New Year's Eve. And then I was on the mag drip all day on January 1st. On January 2nd, I was pretty stable. Like I still felt like crap, but I was all right. January 3rd was kind of a similar story. I was still in the hospital, but I was kind of okay. But I woke up on January 4th and I was absolutely hallucinating. And my blood pressure was like 200 over 90 or something horrible. I don't even
Mhm.
remember the exact number. It's in my book, but it was not good. And my doctor came in and they were like, okay, we're having this baby. I had already had a previous C section. And so I didn't really care if I had a C section, like a natural birth versus didn't really matter to me. Um, so we went in and I had my C section. It was very quick. Pearson, I didn't even look pregnant when I admitted to the hospital. Pearson weighed 1 pound and 14 ounces. I didn't even know I could have a baby that small. And like, I didn't get to see Pearson at all. Like, my husband took a picture of him on a cell phone and showed me, like, this is what our baby looks like. But I mean, he was whisked away from me immediately and taken to the NICU. I didn't get to see my baby until almost 12 hours after that. And there was no like holding of the baby. Like, I got to see the baby in the isolate. They let me like put my hand on his diaper, but like his skin was not like our skin at that
I,
point.
I know exactly what you're talking about. I have a cousin that was very premature, and the her skin was clear.
Yes. So there's no holding of the baby. There's no
Hmm.
touching of the baby. That's actually very dangerous. So there's none of that. And I went back to my room, and other women are coming back from labor and delivery with infants. So I'm back in my room doing the hormone dump that Jeselle and I just talked about. You know, after you give birth, again, your body is dumping hormones out. And I'm sitting in my room just sobbing because I have no baby. I assume my baby's going to be okay. I don't know. And then I'm hearing infants cry around me because women who were able to give birth are coming back to the room with their baby. And my baby, I have to get somebody to like put me in a wheelchair to take me to see my baby. Thank God I did not have postpartum preeclampsia, which I know women who have had that, and that is horrible because for me, birth was the solution. Like, once I gave birth, everything in my system kind of went back to normal. Well, I was back to baseline pretty quickly after giving birth. Like, I think literally within a day, my blood pressure was fine. They did keep me on a low level blood pressure for like a month just as a preventative, just to be sure. But my blood pressure went back. But for women who have the postpartum eclampsia or preeclampsia, then there's no end in sight. Like, well, when am I going to get better? And they also have that problem while they're actively parenting and mothering and caring for their baby. So that's a lot and not a good scene. The other thing that I'll add, I think the only thing that helped me and that the only thing that mentally helped me was this awesome guy named Dr. Art Payne. Because in those 2 days where I was okay, like I was in the hospital and I didn't know if I was going to be living in the hospital for 90 days or if I was going to be having a baby. At that point, I was thinking I was going to be living in the hospital for 90 days. And I was also not looking forward to that at all. Like, I didn't want to live in an 8 by 8 room for 3 months. And that's what women have to do who have preeclampsia. I mean, that is what you have to do. Dr. Payne came in to see me, and he was the neonatologist. And I was scared, and nobody had told me anything helpful. And Dr. Payne came in and he said, well, you're 26 weeks, you're gonna be 27 soon. He was like, for most women who have a baby at 27 weeks or after, your baby has a 95% chance of survival. Like, it's gonna be a long road in a NICU, but essentially, we can grow your baby in an isolate instead of it growing in your belly. The chances of survival are really, really good. We don't need to talk about the 5%. Let's focus on the good. The 95%, you're going to be fine. And he was like, he gave me a lot of information. He warned me that I would not be able to hold my baby. He warned me that the skin was going to be different. So, like, he talked me through some of those things that, like, I would need to know. So I wasn't surprised when my baby got whisked away to the NICU. I didn't even get to see it.
Absolutely, yeah, because that's way traumatic.
Way traumatic. So I was prepared for that. Like, I knew that was going to happen. So that was good. But the most important thing he said to me is he said, do you have any questions? And I said, yes, I do. I said, is this my fault? What did I do? And he was like, you did not do anything. He was like, we have no idea what causes preeclampsia. He's like, it could be hereditary, but I don't have any of that in my history. He was like, this happens to 22-year-old marathon runners. It is more
Mm-hmm.
likely when you're over 35, but he's like, but ultimately, and I was exactly, I was 35. I turned 36 like the month after Pearson was born. He was like, this happens to 22-year-old marathon runners. He was like, the best theory I've ever heard as to why it happens is that it has something to do with the way the sperm and the egg implant into the uterine wall. When the egg implants, the seal is not as good as it is in babies that make it full term. So they think that what happens is as the baby gets bigger and as the uterus expands, the placenta becomes more unstable, and that instability in the placenta is what makes your blood pressure go crazy. And so then you have to give birth. But at the end of the day, Pearson is 10. He turned 10 this year. He is fine. He had a relatively atypical stay in the NICU. He is very healthy. He is academically gifted. He is reading on a 10th grade level, even though he's only in the fourth grade. If you saw Pearson
Wow.
yeah, Pearson is smart. If you saw Pearson right now, you would have absolutely no idea that either of us had gone through all of that. Like, he is truly fine. So I guess if we like just to kind of give, and Sela, I certainly want to hear about what happened with you too, because I assume you're so
Mine is way different from your guys's.
I'm sure. But I think some of the big takeaways that I just want listeners to this to know are, number one, know what it is. Like,
Yes.
Mhm.
don't assume, like, make sure you know what preeclampsia is. The Preeclampsia Foundation has a wonderful list of the symptoms. Don't write your symptoms off. Go to the doctor, buy a blood pressure cuff at CVS, check it yourself in your house. Know what a high blood pressure rating is for a pregnant woman, but definitely know what it is, because it can kill you. If I had just gone to bed that night, I would have died. I
Yeah,
100% know I would have died. So, and I
I
felt fine
almost
after
did.
the headache went away, but I would have died. I also want to add too, I did have a third child after Pearson, which Paul was unplanned. Like, I did not think I could have another baby. And we had a very typical pregnancy until around the 36th week. They had me on baby aspirin, not from the
Hmm.
beginning, but from about week 6 through the rest of it. Because baby aspirin early in a pregnancy can cause an implantation problem and you'll miscarry. But from week 6 forward, they had me on baby aspirin. And then they delivered Paul at 36 weeks because I had hypertension, but I didn't have preeclampsia.
Yeah.
So, Sela, what happened to you, and what year was this?
This was in 2007.
Okay.
So this was with my third child. I was 28 years old. Very unplanned pregnancy. As a matter of fact, her father was very abusive. So it was I was actually separated at that time, and I was going to school to become a vet tech, and and I was doing all of that stuff, and then I found out that I was pregnant, and it was a rough pregnancy throughout the entire time. One, because I was an addict, and to help me get through school was I absolutely depended on my methamphetamines. And so being pregnant, and so it was kind of weird. So I had one pregnancy test come up positive. All the other pregnancy tests came up negative. So
Wow.
well, yeah, I went in, I was, so I found out, I took a pregnancy test. I was like, I didn't have a period for a while. I'm sick. I lost my job as a vet tech. And this was right at the end of my schooling, you know, and, because I had missed a mandatory meeting because I couldn't get out of bed. I was so sick, you know, and I thought it was because I had an infected tooth or something, you know. And then I was just kind of dawned on me while I was driving. I was like, maybe I should take a pregnancy test. And it came up
Mhm.
pregnant, like positive immediately. And I was like, oh crap.
Oh, wow.
And and then I ended up going back to her father, going back into that relationship. And I worked for my mother. She owned her own cleaning company, and ended up losing his job. My mom ended up breaking her back. So I was cleaning houses all through my pregnancy, and I did not have a doctor. I could not afford I did not have any insurance. I could not afford any doctors, so I was not under any doctor's care. I went to jail over traffic tickets when I was about 4 months pregnant, and all the tests they were wanting to give me TB, and I said no, I'm not gonna. I'm pregnant. You're not gonna stick me with anything. You're not gonna do anything to me that can, I don't know what that's gonna do to me or my baby at this point. And they took like 5 different pregnancy tests, and they all came up negative. And right prior to that, I had had a miscarriage or a phantom pregnancy, they called it. And so I thought that at that point, okay, I'm making this up and I'm thinking that I am feeling gas bubbles and I'm making it as a baby, you know.
So even you thought that maybe you were having not a real pregnancy at that point.
Yeah, well, because I had the same things happen to me, and what happened was I had lost the baby, but my mind didn't know it. And then after going in, I had like a really heavy, heavy period, and then I went in, and they were like, "Well, there's no sign of you being even pregnant. Like your uterus isn't expanded, nothing. So you're not pregnant." So I thought, okay, well, maybe I'm just having another phantom, or maybe I'm, making this up because he wasn't feeling anything or anything like that. So um, then when I was about 7 months, I went to the hospital because with all of my pregnancies, I went into preterm labor at 7 months. And I went into the hospital because I was just cramping really bad. And I was just like, I'm wondering if this isn't feeling right. You know what I mean? This doesn't feel like a normal period. I'm wondering. And I kept feeling the kicks. I kept, feeling stuff throughout all of this. And I just kept ignoring it. And the doctor even was pressing, and he even kicked him while he was pressing down on trying to feel for my uterus. And he was like, I don't feel anything. So I was like, okay. And at that point, I felt defeated. So I just left. I didn't wait for the ultrasound or anything. I just left. And then later on that night is when somebody else finally felt her kick. He put his arm over my stomach, and he literally kicked. And it was okay, you are pregnant. But I still couldn't afford anything. And when I thought I wasn't pregnant, I started using again. The second I found out that I was pregnant, that I was really a pregnancy, I stopped using. So I was going through withdrawals at the same time. Like come my birthday, I was like, I didn't have a for sure date. Um, Through going to the hospital or something like that. I can't remember exactly. Everything was kind of, this was a long time ago, and head injuries. But the I had a approximation of March 14th if I was pregnant. My birthday's March 11th. And I was like, I am no way going to spend my birthday in the hospital. I was in the hospital. So 2 weeks prior to giving birth to her, I went in. I was sick for a week. I was throwing up. I couldn't keep any water down. I couldn't get out of bed. I was giant headaches. I wasn't really having too much swelling, but I was having all this other stuff. And I went to the hospital. My mom took me, and my mom and I were in a very bad relationship at that time. And so she dropped me off at the emergency room, and they just gave me a bag of fluid and put me on a prescription and sent me home because I was having, I call them rotten egg burps. They were very sulfuric type of burps, and I was getting those as well. And then I started taking the medication, the rehydration made me feel a little bit better. It was a quick Band-Aid. Later on, if you find anything out, is that, giving that kind of fluids to somebody that has preeclampsia is not the best result, because it is not the proper way to handle things. And my ketones were off the charts. And they didn't put the morphine that they gave me. They didn't put the prescription in my file. They didn't do any of that. So then 2 weeks later, here I am again with that bad burp again. And I'm like, I'm in a lot of pain. I mean, 3 days of just rocking back and forth like this
Yeah.
from pain. And I thought it
Yeah.
was my shoulder, but I went to the hospital. I got dropped off at the hospital by my husband at the time, after fighting with me because he was pretending, you know how narcissists are. They pretend to be doing something actually that, when they're really just not doing anything. But I got yelled at for asking him to put the car back together for me to take me to the hospital. And then I went into the hospital and they gave me morphine right away because I was like, this pain is worse than labor. Like I need something. I mean, I can't barely breathe. So they started giving me morphine right away. They started giving me, they then they gave me some other stuff, and I'm really really sick. I was back into the 3 more days of nonstop puking, and I'm really not all there.
Yeah.
And the doctors I had were horrible. The experience I had was horrible. I was treated so after giving me morphine and giving me the full doses of morphine that they could
Mhm.
possibly give me while pregnant, they went ahead and they went ahead and induced me. I don't remember what my blood pressures were. I don't remember too much because the morphine knocked me out,
I bet.
and I didn't sleep for 3 days prior to that, 3 or 4 days, because I was just in so much pain. Like I was taking baths and just like laying in a bath and floating in a bath would help. Like I was trying to figure out anything and everything because I had no idea what I was dealing with, and I was dying. I did know that because of being a vet tech, you understand that color of urine tells you a lot about your body, and my urine was brown.
Oh gosh.
Yeah, my urine was brown, but I was like, nope, I need to give it a little bit longer to make sure that she's okay. Not understanding. I knew that there was something up, but I didn't know what. And so I don't remember my blood pressures or anything. I just remember nurses coming in and just jamming their hands inside of me and being treating me really bad because after they gave me morphine and then after they did all of this other stuff, they then gave me a drug test. And I did come up positive where for methamphetamine or methamphetamines, assumed methamphetamines, but I came up really positive for heroin. They treated me like a piece of crap drug addict person that couldn't get off of it, couldn't get off that chose the drug over the kid is what how I was treated the entire time. I finally gave birth. I remember waking up in more pain and them saying, "Well, it might be because you were ready." Because they gave me an epidural at 2 centimeters, because they couldn't give me any morphine. And I was so sick. I was in and out this entire time. Like I don't remember too much. And I remember waking back up and just being in a lot of pain and then saying, okay, no, you're actually ready. And I gave birth. And they I don't remember too much other than them keep waking me. They kept waking me up to take care of my baby, to take care of my baby, to take care of my baby. Well, every other time that I've been in the hospital, this is my third child. I've had two before, and it was a no, let us take care of your baby, you rest. It was, no, you need to take care of your baby. Your baby's hungry. Your baby needs to be changed. And I literally the doctor said my kidneys had completely, totally failed. I had complete, total kidney failure and liver failure. And I was going through a systematic shutdown. My body was going through the systematic shutdown so that I had ignored all of my organs had swelled up so much
Mhm.
that it was just all shutting down. I don't know if I had any seizures. I don't remember too much, but I do remember that not even 24 hours later, they came in and said that they were going to hold my child against me or to hold my child because there was morphine or there was heroin found in
Yeah.
her system
Yeah.
and amphetamines, assumed methamphetamines. So here I was, and I was like, I haven't done anything, I was like, at the beginning, but that wouldn't be in my system now, and I had fought it, but yeah, within 24 hours, they didn't wheel me out of the hospital. I walked. They gave me my discharge papers, and I had to take an elevator down 8 flights and walk out to my car in the parking lot after having complete total kidney failure, liver failure, systematic shutdowns. And I know that they're supposed to hold you for at least 75 or 70 or 72 hours after giving birth if you have a preeclampsia at all. And they literally gave me my discharge papers and said, "Here you go." And I was leaving without the hospital without my baby. They put her in the NICU because she was jaundice. And I then went after 7 days after giving birth, having complete kidney failure, liver failure. I went back to work cleaning houses because I couldn't. Yeah, while I was fighting CPS, while I was going and giving a whole bunch of, not a single one of my urine tests came back dirty after the hospital. Not, and they couldn't get all of my hair that they collected was all inconclusive, and they would not allow me, and I couldn't afford a lawyer. I didn't know what I was going through. I didn't like, it was pure hell. So here I was going through all that dump and trying to heal from kidney failure, liver failure, systematic shutdown.
Yeah.
And they didn't put any of the medications or anything. And it wasn't until after I finally got all the charges dropped for
Mhm.
the and because they couldn't, there was not enough evidence, and so the judge actually paid for a lawyer for me, because when I was standing there and he wanted me to give my plea, I was like, just had, and just tears just rolled down my face. And he goes, "Honey, you obviously don't know what you're dealing with or talking or look, how about this? I see that you need some help, and I'm going to pay for your lawyer out of my pocket." And so that lawyer did a deal for me. And it was, for random drug tests for hair and urine for a month, they all came up clean, and then everything was dropped. There was no, like, all the charges were dropped on me. Um, but I still had to have nurses come up to the house and tell me how good my heroin addict baby skin what looked, because most of the time they're dry and patchy skin, and I'm going through, and I'm like, I didn't do any of that.
Right.
It was so frustrating, and it really, with the being in the midst of an abusive relationship, going through um the CPS and all of that, trying to heal and working, cleaning houses. I was bending over bathtubs. I was, mopping floors. I was doing all the things I should have not been doing.
Yeah.
Literally 7 days after giving birth. So
You know,
that's my
Sheila,
story.
Sheila, thank you so much for like talking about that. So, aside from the preeclampsia, which was horrible, and all those awful ramifications that happened to you, probably because you're exactly right. I think you were stigmatized
Hmm.
by the medical profession, which led to you not getting the quality of care that Jeselle and I both received. But also, thank you for your honesty about that. You know, my community has something recently called the Substance Use Network Sun. And it's one of the most amazing things I've ever seen, because we had a doctor at our health department named Dr. Russell Suda. And Dr. Suda retired, but he didn't want to stop practicing medicine. So he works only with women who are addicts. And so basically, if you are an addict in our county and you are pregnant, then if you enroll in the Sun Clinic, Dr. Suda treats you through your whole pregnancy. And I think with most of those women, he's giving them methadone because you need to be able to stay on something while you're pregnant or you'll
Yeah,
wind up
because you
having
got
to
to function. Then
yes,
and that's where I was because I had done it so heavily, especially during school because I was working full time, going to
right.
school full time. I was literally doing 5 days a week. Or no, I'm sorry, 4 days a week, 5 hours a day of schooling because I was cramming in four
Sure.
years of school into 16 months, you know? So
Yeah.
so I was going through all of that and I forgot what I was going to say. Sorry. Go ahead.
But no, but Sun also, we see so many women through, or he sees so many women through the Sun Clinic who are also in violent relationships, exactly like you described. And also, one of the other things that they do is they work with the moms on the psychosocial component of it. And they have therapists who work with them. Many of these women were sexually molested as children.
Mhm.
And so
Yep.
that led to a lot of the addiction and the bad relationship choices. But the other thing that I love about this whole model is that they have a contract with the Department of Social Services because they know these children are going to be born positive. I mean, they know they are.
Yeah.
Their mothers are on methadone, but as long as they're enrolled, instead of taking the babies away from them, they have a separate, like a special unit for them, so the moms get to stay with their babies. Even though the babies are also going through some drug withdrawal, mom gets to be with their baby because they said there's a new study out about this that say babies who are going through withdrawals need their moms even more than healthy babies do because it's
Yeah.
traumatic. I mean, you're used to living in that environment as a fetus and hearing mom's voice, and being ripped away from that is also traumatic. So, I mean, I appreciate you telling that story. I think that Sun is unique and it's actually kind of rare. And I really wish that that would be something that we would see more
Should be
nationwide.
something that is absolutely something that's funded big time because, even I did drugs on and off like when it was like okay and the amounts of amphetamines, assumed methamphetamines that were found in my system were literally within legal limits, but at that point in time there was a lot of on the county that we lived in there was a lot of pressure and on the social social services. There was a lot of pressure from because the federal government was investigating the crime
Mhm.
because of a lot of babies being found in garbage cans and in stuff like that at casinos and stuff like that.
Yeah. And
So
programs like Sun stops that.
stop
You
that
know,
stuff.
yeah, it
Yes.
stops it. And the other thing that they've seen too is that a lot of times women who are addicts know one another because they're friends with other addicts. And so
Yeah.
a lot of times, like when we have one mom who we're able to take care of, when she has a friend who's pregnant, she's able to kind of give her like, well, go see Dr. Suda because he's going to take care of you. And honestly, in so many of those circumstances, we haven't had one baby born in the Sun Clinic die or wind up in foster care. So, and
That's
most of their
amazing.
yeah, and most of their moms are really getting it together. And I think it's literally because of the social work and the psychological component. Because these women want to be good mothers, they love their babies, and for
Mhm.
many of them, becoming a mother is the life changing event that they've needed to clean up. And so
Yeah.
it's really been amazing to see what they've been able to do in that program. And again, I really wish that we could destigmatize that because so many women in your situation, no one grows up and says, I want to be a drug addict. They wind up using because of other circumstances.
Promise.
And if you can help treat those circumstances, they can be wonderful mothers.
But see, and
Yeah.
it doesn't help when when there's so much shame. They're already shaming themselves, and somebody is actually willing to step out there and help them and not bring that judgmental or that shame upon them and just actually help. That's amazing, and
Yeah.
that is
It's a
where we
great
really,
program.
yeah,
Yeah, I think
that's
it's
where
something
we
that we
need.
need to really focus more on and spread. That's a program that needs to. to kind of throughout this entire country because
Yeah,
that's
there's a whole memorandum of
that's so
under.
life changing right there. Like
Yeah,
wow.
and it
Like if I
took
would have
like it.
had something like that, with the difference that my, things
Right.
would have, how things would have ended. I mean, like, I'm
Yeah.
I'm I'm fine with how things ended. I am where I am, and I'm doing what I'm supposed to be
Right.
doing. But like, the difference that because I did suffer, especially Las Vegas is not one of the best places to get
Oh,
assistance when you're, and it's once you get into the system there, they like to keep you in the system.
yeah.
Um and so it was, Las Vegas was just one of the hardest places, and you do feel so alone, especially when you're an addict and in an abusive or domestic relationship. You just feel so alone.
Well, what we see too is a lot of those women don't have any family support. Either they
Yeah.
didn't have any family support in the first place, their
Nope.
family support was their first abuser, or their abusive boyfriend has isolated them from their family so much that they're really cut off. So that social worker therapist component really acts as the family support that they don't otherwise have. Anyway, I'll send you guys my web link about them so that you
Yes,
guys
please
can like
do.
read more about it and post it because I
Well,
really
yeah,
do
we
think
would
it's a
definitely want to put it in the footnotes and stuff like that too, you
yeah.
know.
And there's a lady in my community named Ann Benfield, and Ann ran the Cabarrus Partnership for Children. And she literally just went and got all these people to the table. So she got Dr. Suda and the pediatrician who treats the babies who don't go to the NICU. You know, before you went to the NICU for drug withdrawal, but not anymore. You go to this PEDS unit with your mom. And
Hmm.
the social workers, the DSS had a memorandum of understanding with Sun, so they weren't taking the babies. And then the social workers and the therapists that were working with the moms, like she just got everybody to the table, organized them, got them to sign contracts, and it's been life changing for everyone.
I
It's
bet it
awesome.
has. It sounds like it absolutely has. It sounds like an amazing program. But
Well,
and
I'm
it's
glad we're all
absolutely,
alive.
yeah, no, right. We all made it through, you know.
We
And that's
are,
why I was
and
like
there are
listening to
other.
your guys' story. I was like, mine is way different from your two, but
Yeah, but we're all alive, and there are a lot of women who aren't.
You know,
right.
I just want to point out because you talked about how well your son is doing and everything. I want to say that my sister is, she's alive and she's fantastic. She is a
Really
beautiful being,
serious.
and and
No
she's
issues, no side effects or anything like that,
no, and she's getting
These
ready to
little guys are
graduate.
so resilient.
Hmm.
It's
And
honestly, it's amazing how resilient little humans are.
yeah, it really is. It really is. Because there was when she was in the NICU, the lady next or the baby next to her was going through withdrawals from crack. And
Yeah,
and mom was there. Mom was right there, and mom didn't love him any less. Mom was right there holding that baby, loving that baby through every moment that she possibly could you
yeah,
know and she was so open about it, and I remember just being like, wow, you're so open about it, like, whoa. And here I am being so open about it. But
yeah.
Paula, this has been amazing.
Thank you. I know I enjoyed hearing about your stories and talking to you too. I hope that this is helpful for somebody listening to it.
Agreed. I really
Absolutely.
hope. All I have to say is that it honestly do not minimize your symptoms. That
Not
that
at all.
is
And know what your symptoms are.
exactly. Know what your
Know it.
symptoms are because the doctors will tell you about them as long as you ask. Because you see the posters about eclampsia. At least I did when I was in my doctor's office. It's everywhere about eclampsia, which is after giving birth. But you don't see
Yeah.
anything about preeclampsia, which is
No.
while you're
And eclampsia is the things that kill you. So, you don't want that at all.
Hmm.
So, all right,
right.
Well,
ladies, thank you.
Thank
yes, thank
you.
you for those of you that went to reach out and Share your story with us. Please email us at 12lookingthrough, THRU 34 theglass@gmail.com. You can reach our Facebook or our TikTok. We have some, oh, I think we have an Instagram now.
We do. We have an
Yeah,
Instagram
we
now.
know we have an Instagram now. But thank
Yeah,
you, Paula. This has been an amazing conversation, and I'm quite sure very, very, very insightful to the listeners. And I would love to have you on again sometime, we could
That
talk all
sounds
day
great.
long. All
That's right. That's great, ladies. Thank you for having me.
right. Thank you.